My name is Anna Stanhewicz, and I'm an assistant professor of Health and Human Physiology at the University of Iowa. In this study, we examined sensory nerve-mediated vasodilation in the cutaneous microvasculature of women with a history of preeclampsia and found that these women do not have deficits in sensory nerve-mediated dilation after pregnancy. Preeclampsia is a hypertensive disorder of pregnancy characterized by new onset high blood pressure accompanied by one or more signs of multisystem organ dysfunction after 20 weeks of gestation. The symptoms of preeclampsia typically resolve after delivery, but women who experience preeclampsia are up to 4 times more likely to develop cardiovascular disease later on in life. It's not clear why this might be, but lasting dysfunction of the blood vessels after pregnancy may be one explanation. We know that otherwise healthy women with a history of preeclampsia have reduced endothelial function in the cutaneous microcirculation, and that this is mediated by a reduction in nitric oxide. It's not known if sensory nerve-mediated dilation and the nitric oxide-dependent contribution to that response is also reduced in these women. Therefore, the purpose of our study was to assess sensory nerve-mediated dilation and the nitric oxide-dependent portion of that response in women with a history of preeclampsia compared to a control group of women who had a history of uncomplicated pregnancy. In this study, we used local heating of the skin to induce a sensory nerve-mediated increase in skin blood flow. We measured this response in a control area of skin and an area of skin where we had locally inhibited the production of nitric oxide. We found that there were no differences between groups in either the sensory nerve-mediated skin blood flow response or the nitric oxide-dependent portion of this response. Next, we examined whether there was a relation between the nitric oxide contribution to sensory nerve-mediated dilation and the nitric oxide contribution to endothelium-dependent dilation measured in the cutaneous circulation of the same subjects. We found no relation in either group or when the subject groups were combined. Together, these data suggest that although they have attenuated endothelium-dependent dilation, women who have had preeclampsia have preserved sensory nerve-mediated dilation in the cutaneous microvasculature. Further, the nitric oxide-dependent vasodilation of the sensory nerve-mediated response is not related to nitric oxide-mediated endothelium-dependent dilation in these women.